This is Monica from Uterine Stanley Ringit, a very good morning to you in case you're just joining us. We do this every single Monday, discussing matters health, and this morning we're discussing matters uterine fibroids. So women, this is really a conversation that you'd really want to turn up the volume and just listen into. Men also, you probably have someone close to you who probably has ever had fibroids, and you're wondering how can I be able to help this person? Or is actually maybe at risk. We'll be getting to understand how this person can actually be helped. And we're asking you where you can always engage with us. Phone numbers are just below the screens, 0795 045864. The phone numbers are open. You can call us and tell us, have you ever had uterine fibroids? How did you get them treated? The doctor is here to just enable you to understand the kind of, because when you mention fibroids somewhere, maybe in the market, people have their own kind of understanding. But then we'll be just helping you understand kile ilichoko. On that, and just helping us understand that is Daniel Nyongesa. Karibu sana.
Thank you so much, Stanley.
What's your specialization on, just to be specific?
Okay. Yeah. So Stanley, my name is Dr. Daniel Nyongesa. I work with MedLife Hospital in Ruiru. I also partly work with Texas Cancer Center as a medical officer in Department of Oncology, Clinical Oncology. Currently, I'm doing my master's degree in oncology at Nairobi University.
Right,
yes.
Right. So even with the whole background of matters, cancer will be helping us understand even its relation with this conversation on matters uterine fibroids.
Yes.
But to start it off, what is uterine fibroids, and how we can also even paint us a picture, because even the photo that we have here is the structure of
yes, the female reproductive system.
Yes. So you can help us understand how it looks and also what uterine fibroids are.
So let's first of all start with the image that you have projected. This is the female reproductive organ or system. What you are seeing is the uterus and its structures, and the lower part actually is the canal, the entrance into the female reproductive system, what we call the vagina. Now, the uterus has parts. The upper part that you're seeing that looks like a mountain, we call it a fundus in medicine. And then it has two arms, what we call the fallopian tubes. These fallopian tubes usually attach on the yellow part that you're seeing, what we call the ovaries. And then down is the body of the uterus. And now the white structures that you're seeing, those are uterine fibroids. What are uterine fibroids? Uterine fibroids, some people call it myomas or leiomyomas or fibromyomas. Those are the same terms that we use in medicine to refer to uterine fibroids. So uterine fibroids are non-cancerous growths that occur in the uterus. So why are we saying non-cancerous? They are just there, they don't spread to other parts of the body, but they invade the structure of the uterus and start to cause pressure and other symptoms that can emanate from this reproductive system. So there are different types, as you have seen. When we say it's subseroso, it means it's towards the outer part of the uterus. But it has not grown as a sling. Like now when you say pediculated fibroid, it's a pediculated fibroid is a fibroid that has a string just attached to the uterus. That's what you're seeing up there. And then we say submucosal. Submucosal, the mucus is the inner lining, mucus layer. Is the inner lining or the membrane of the uterus. So when we say it is submucosal, it's just below the mucus, the lining of the uterus. Then when we say it's intramural, intramural means it's within the muscular structure of the uterus, like what you are seeing there. So these are non-cancerous growths that occur within the uterus as a structure.
Out of all the types that you've shown us, is there one that is particularly more more dangerous than...
The commonest type of uterine fibroid are what we call the intramural, which means they occur inside the musculature layer of the uterus itself. Those are the common, almost about 70%. But occasionally we get the subserosal, we get the pedagulated, and this, especially the pedagulated one, because you see it's hanging like a sling, it has a chance, very high chance of torsion. Torsioning means it twists and then it blocks the blood supply to that uterus, and it usually presents with severe pain because of that torsioning.
All right.
Yeah.
So does that mean the pendaculated one is, let's say, the most dangerous of
course,
all of them?
Each will come with its own complications, but the commonest one that we get, patient presenting with acute abdominal pain, a sudden onset of pain, is the pedaculated one because of torsion. It is free flow. It is just swinging around the abdomen. So twisting is very common with the pedaculated one. And actually, sometimes even the ovary, if it gets a cyst, it can also twist. So the major causes of lower abdominal, acute abdominal pain occurring from the structures of the uterus is actually either a cyst in the ovary has torsioned or a pedaculated fibroid has torsioned. So once you do an ultrasound, you'll get to know which one are we talking about. Is it a pedaculated fibroid that has torsioned or a cyst within the ovary that has torsioned, therefore presenting with acute pain? So all of these can occur. But as I said, pedaculated ones and the submucosal, subserosal, they are not as common as the intramural ones.
Right.
And therefore, this presents a lot of clinical features in terms of how do we make a diagnosis of fibroid. Because majority of them, especially the submucosal one, are asymptomatic. A woman will not complain about them. The ones that we get a lot of complaint is the pedaculated one because of torsioning, as I've said, and submucosal one, which means they cause a lot of erosion into the inner layer. So during menses, women can present with heavy menses. So those ones may present early with symptoms. But the commonest, which accounts almost about 70%, they don't have early signs, especially when they are below 4 centimeters. There is a critical expansion that can start causing symptoms. So these ones, if they are
so 4 centimeters for all of them?
No, especially the intramural ones.
Okay.
If they are less than 4 centimeters, rarely will a woman complain of symptoms. And we will talk about now how will they present, because they are the most common, and yet they don't cause acute symptoms that a woman can present with. So the 30% that we have talked about that can present with acute symptoms like sudden onset abdominal pain are now the 30%, and they are not very common.
Right.
So when they occur, they present with very severe acute symptoms. But the commonest one, which are intramural, most of the time they are asymptomatic.
Is there a specific cause to even the common, the intramural, and majorly all of them? Is there a specific cause that would really point out and say this is why maybe a woman has them?
Unfortunately, when we are talking about any type of growths, abnormal growths that occur in the body, be it cancer, be it non-cancerous tumors, these are tumors or growths, there is no single specific risk factor that we can pinpoint to. And therefore, this has come up, made us come up with a general term of saying risk factors. What are the risk factors that can predispose us to getting some of these growths, be it cancer, be it non-cancerous growths? It points to an analogy where we say it is multifactorial. No single most risk factor is more important than the other. So if you have majority of these risk factors is when you are able to get these growths. And for fibroids, remember, 20 to 40% of women, if we get 100 women in a room, 20 to 40 of them will be having fibroids. So it's a common occurrence in women, what we call within the reproductive age. And the reproductive age here, we are talking about women between the age bracket of about 15 to 45 years.
Are there unique trends that are quite unique to Kenya, this multifactorial, all these factors?
Yes.
Are there certain unique factors that you'd say, so this we've realized over the years that for this type of women in different parts of the country, this is why these are the factors that would lead these women to have fibroids?
So just to begin with, being a black, so our race as black people, it predisposes us or our women to increased chances of getting fibroids. This means that when you compare the occurrence of fibroids in blacks vis-a-vis the Caucasians and the whites, we find that Africans are more affected. So just the race itself, it is also an increased risk factor of us getting fibroids.
Why is that? Does it have to do with matters pigmentation
Yeah, just as I said, you know, we in medicine we talk about what we call scientific facts. And for scientific facts, for you to be able to say pigmentation, whatever, you must have done a research that actually pinpoints you towards that direction. So I can just say it is an occurrence that we see, that when we compare Africans and whites, Africans are more affected, but we don't know really the reason. It could do with the foods that we eat, our genetic makeup. But that reason, that basic scientific reason, has not yet been
proven.
Yes, proven. So we just say being an African is a risk factor.
Right.
If you ask me how, I don't know. I don't know. Nobody knows. Yeah, it's just an occurrence that we see when you are doing our statistics that are commonly affecting Africans than the Caucasians. And then other risk factors are things to do with inability to produce children. They say your uterus, if it doesn't grow babies, it will grow fibroids. It's an occurrence that we have seen in women who delay in getting their babies, especially if you get your firstborn above the age of 31 years, majority of these women have fibroids.
So if this woman gets, or rather doesn't have a child past the age of 30, around 31,
majority of them.
Okay.
Majority of them will present with fibroids. And that's why we say, if you don't grow babies in your womb, you will grow fibroids. So this just tells you that there's some hormonal influence towards development of fibroids, because the period of pregnancy, it's associated with a lot of cessation of most of these female reproductive hormones. So there's a time you become silent. When you are growing babies, the hormones go silent, especially the estrogen hormone. Estrogen hormone is the one that has been associated so much with fibroids. So this period of cessation of production of estrogen hormone kind of protects you from getting uterine fibroids.
So now, apart from, because other women would say, I got a child even before 30, but then I still had fibroids.
Yeah, that's why.
So are there now other risk
that's
factors?
why you're talking of multifactorial factors.
Yeah.
So other risk factors of fibroids actually use of what we call exogenous hormones. Exogenous hormones, these are hormones that we take into the body. It's not our body making them, but we are getting them from outside, external source. And the most commonest external source of this hormone is by use of contraceptives. So especially the estrogen-containing hormones actually predispose women to getting fibroids. Okay? And then other risk factors, they talk of lack of exercise, obesity. Obesity itself is a risk factor because obesity is associated with high level of estrogen. Not estrogen, but cholesterol. Okay. And what is the source of estrogen in the body? They are what we call steroid hormones. And these steroid hormones, their source of production is cholesterol. So if you have high levels of cholesterol in the body, then it means your levels of estrogen are a bit higher, and therefore it predisposes you to getting fibroids. And it goes without saying that exercise is a protective factor against uterine fibroids, and lack of activity, lack of exercise, inactivity is a risk factor to getting fibroids. Another thing that
and before we now cross over to another factor,
yes,
for the obesity, because a number of women would be listening to you and they'd be wondering, so how much should I be weighing so that I know, well, I'm at least at the range of not being being able to actually get the fibroids. Is there a limit that maybe studies show that?
So most of the studies have associated fibroids with a BMI. There's something we call BMI. In BMI, we compare your weight and your height and we standardize it. It's supposed to be between 18.5 and about 25. So if your BMI is above 25, it means now you are overweight. So any BMI above 25, we call it overweight. So between 25 and 29 is overweight. Then obesity starts from 29 to about 39. Then that is what we call obesity grade 1. And then morbid obesity or obesity type 2 or grade 2 is when you have a BMI of over 40. So BMI, we look at your weight and we look at your height. It means that if you are overweight and you are shorter, your chances of you being categorized as an obese or an overweight person is higher than when you are taller. So the taller you are, the higher chances that your BMI may fall within the normal range. But fortunately, Africans, we tend to allow a little bit of a higher BMI, a BMI of between 18 and up to 28 there. For Africans, we have seen it is not associated with so much problems that occur as a result of obesity or overweight. But for Caucasians, anything above 25, you see, like in, say, American height, they are supposed to be very tall. So if you're having a BMI over like about 26, then already you are in trouble. So for Africans, we tend to allow a little bit of higher BMI, like up to 28. That is not a very, very bad risk. But anything above 28, then you are entering what we call danger zone of being categorized as obese, and now with the effects that come with obesity, like fibroids, increased risk of cancer, and even cardiovascular diseases, hypertension, high blood pressure, heart attack. We see them happening to individuals with BMI over slightly above 28.
So if your BMI is around 39 and you're a woman in Kenya, those should be, it should give that green light of, let me get a checkup.
Yes, you need to go get checkup, and not just for fibroids, but even for other conditions like cancer. It has increased chances of people getting into cancer. Remember, there is also a condition known as diabetes. Diabetes actually is what we call the commonest type of diabetes, diabetes type 2, which is actually associated with increased BMI. Such that your fat, your fat level, your cholesterol levels in the body, it starts to do what we call downregulation of insulin receptors. So your body becomes insensitive to insulin, not because you're not producing, but because you have a lot of fat content within your body. So the cells become dormant. They don't take in insulin, and therefore you start having poor regulation of your sugars, and you fall into the risk of getting diabetes type 2. And other cardiovascular conditions that are associated with diabetes and obesity.
All right, fantastic. So now, because you told us a woman in this reproductive age between 15 all the way to, is it about 40?
45.
45. So in this age bracket, and they have a lifestyle of alcohol intake and all that. Is that a huge factor?
Alcohol is also a very, very great risk factor that has been associated with the development of uterine fibroids. And alcohol actually does almost the same thing like what obesity will do. So people who indulge or excessive use of alcohol, they're also again associated with poor eating habits. Obesity also ensues. And remember, the liver is also destroyed. The liver is a major organ in the body that participates not only in the detoxification of these radicals within the body, but also it helps in metabolism of important hormones, and estrogen is one of them. So people who tend to use a lot of excessive alcohol, they tend to be associated with high cholesterol level and also high estrogen level, just because of interference of metabolism that happens within the liver. So these people also tend to get a lot of predisposition to these uterine fibroids.
Earlier you told us that about 20 to about 40 women out of 100, if you had 100 women in this room, and
Yes.
so about 20 to about 40 of them, possibility of them having fibroids is quite high.
Yes.
But then, so how do this 20 to 40 women actually know, without even getting to having the checkups? How do they know that, and they rather even actually suspect that I might actually have fibroids?
As I started, so the commonest is the intramural type of fibroid,
Yeah.
and most of the time they are asymptomatic. So if you're having a fibroid that is less than 4 centimeters in terms of length, you may just be asymptomatic. You don't have any symptoms.
Right.
Sometimes you just find them incidentally. A woman comes, says, pregnant.
Actually, allow me to interrupt you. We do have Rosa from Kasarani. Rosa, habari asubuhi.
Poa.
Asante sana kwa kutupigia. Kuna swali for daktari?
Yeah.
Uliza.
Mimi nimefanyia skani. Poa sana.
Endelea.
Yeah, nimefanyia skani. Lakini sina hizo fibroids. Na sina hizo fibroids.
Okay.
Lakini nikifika ball huwa na miscarriage at 3 weeks. What is the main problem?
Okay.
Nitamjibu.
Sawa. Asante sana Rosa kwa kutupigia. Salimia toka Kasarani. Daktari will be answering you right now.
Okay.
Sawa. Pole sana Rose kwa hiyo shida ambayo uko nayo. Wanasema chanzo kikubwa ja kupoteza mimba kabla ya kufikisha ama within the first trimester inakuanga ni genetic abnormalities. Kuna zile abnormalities ambazo haziwezi kuwa compatible na life. So, chromosomal abnormalities, amepata mtoto ambaye akona abnormalities, for example ya kimaumbile. Labda ingekuwa na shimo kwa roho, labda angezaliwa kama ameshikana, kichwa imeshikana na kifua, ama brain ya mtoto ija develop mzuri. Hizo genetic abnormalities ni hali ya kimaumbile ambayo Mungu ameweka ya kwamba hizi mimba ambazo ziko na gross malformations sisiweze kupita hata first trimester. So most of them zinakuwa miscarried kabla hatujafikisha even 12 weeks ambayo period ya first trimester. So ukiona ziko hivyo sana ni shida ya kimaumbile, na wanafaa kwenda waone daktari ambaye anaitwa obstetrician and gynecologist aweze kuwafanyia utafiti ili tuweze kujua. Saa zingine inaweza kuwa imetoka katika mama, ama ingine imetoka katika mzee, ama wote wako na chromosome ambaye iko defective ambaye inachangia hivyo, na si kuweza kupata kujua kama akona mtoto mwingine mahali ama hapana. Sana ukiona hivyo hao watu wanakuwa na shida ya kupoteza mimba kabla ijafikisha 12 weeks, which is the first trimester.
Thank you, Rosa, for calling. Remember, you're back at home or wherever you're watching us from, you can always call us live. If you're a woman and you probably, you're in that bracket, maybe 15 all the way to 45, and umesikia daktari hapa talking about all those kind of risk factors, and you're probably suspicious of maybe I might have fibroids. Call us live and tell us rather your feedback, your opinion, your thoughts, and even those questions, daktari will be answering them. Men, you could actually call in live and ask on behalf of your sister, your wife, your daughter, and upate all those kind of questions, rather answers that you really need. 0795-045-864 is our number to call in live. 22047 is our SMS number at TV47KE, and tell us, have you ever had uterine fibroids? Kama ushaipata, how were they treated? Right. Najua we have ni Chanel kutoka wapi director? Mwea. Chanel, asante sana kwa kutupigia kutoka Mwea. Uliza swali kwa daktari. Chanel, sijui kama unanipata? Asante sana kwa kutupigia. Habari ya Mwea?
Nzuri.
Yes, unaweza paza sauti kidogo tu alafu uulize daktari swali.
Mimi. Hello.
Hello, yeah, tunakupata, endelea.
Nzuri.
Endelea. Punguza volume ya TV alafu uulize daktari swali.
Mimi. Sijapata menses yangu. Within 2 months ago. Na yani ikikuja inakuwa kidogo.
Okay.
Sasa nilikuwa nauliza hiyo ni shida gani?
Sawa. Aya, asante sana, salimia watu wa Mwea. Daktari?
Anasema period yake kuna.
Amesema hajapata the menses for 2 months ago. And she'd really like to know where, yeah.
So kitu kama hiyo, unajua for us to be able to make a diagnosis, siwezi mwambia shida ni hii, shida ni hili. Tunahitaji proper history, tunahitaji clinical examination, and sometimes hata kufanya some tests, scan, lab tests, to rule out or rule in some of the diagnosis. But the commonest cause ya hiyo shida yake ambayo ako nayo, kwamba mtu amekaa miezi 2 na hajapata hedhi, hajaenda hedhi ya mwezi, inamaanisha the commonest inazikuwa ni kwamba huyu mtu ako na mimba. So mtu kama huyu lazima apimwe hiyo pregnancy detection test tuweze kujua kama ni mimba iko ama haiko. Na pia hatujui kwa historia kama ako na historia ya kuchumbiana, hali ya kuchumbiana na mwanaume katika period fulani, ndio tuweze kusema kama umekuwa hivi kunaweza kuwa hii. So kitu kama hiyo ningependa kumwambia aende kwa daktari, aweze kupatiana ujumbe yote, history, aweze kufanyiwa examination, na daktari atamtuma test, either lab test ama even scan, to try to know what is happening within her body.
Right.
Lakini atuwezi mpatie jibu ya straight on kwamba hii ni hii.
Ndio inaweza kuwa.
Yes.
So I hope umepata jibu. 0795-045-864 and your number ya kutupigia simu. Ukitupigia simu make sure that umezima TV ama umepunguza volume kabisa, umepaza sauti na ukauliza swali au maoni or the opinions that you have. Najua kuna zingine nyingi sana zinaingia, tutakuwa tunapata. But before that, so daktari, even as you get another caller right now, you told us that the chances of when you, let's say past 30, this is basically your body telling you, and if having the fibroids. Okay, let me pick this call. Mercy from Elgeyo Marakwet. Habari ya asubuhi. Mercy, habari ya asubuhi.
Nzuri.
Asante sana kwa kutupigia. Uko na swali au maoni?
Niko na swali.
Yes, uliza daktari atakujibu.
Niko na shida ya biliary. Nzuri.
Yes, endelea. Punguza sauti ya TV alafu uulize swali. Yes, okay, tumepoteza Mercy. So and hopefully back tutapata Mercy arudie hiyo swali call us live 0795045864. Tafadhali, when you're calling us, mute your TV. Si lazima ujisikie pia. Mute your TV, alafu tuambie where you're calling us from and be audible enough. Paza sauti vizuri. So before Mercy called, so you told us that, let's say when you're 30, and the fact that, let's say you have fibroids, it's basically your body telling you that, or rather, it's like, you're growing fibroids instead of growing babies.
Yes.
That's what you told us.
Yes.
So, but then you'd find in this age gap, there's a woman who decided to be celibate and not, want to have children and all that. Does this mean that for a woman who decides to be celibate, they are on a risk factor to actually get fibroids?
Not only just fibroids, but also risk factor for cancer, like ovarian cancer, and even breast cancer. So, of course, getting children below the age of 30 has been associated or is known as a protective factor against all these reproductive kind of problems that women get. So for those who choose to be celibate, just know that there is a risk factor.
There is a risk.
That you can get breast cancer, you can get ovarian cancer, or even uterine fibroids.
Right. Susan kutoka Iten, Elgeyo Marakwet County. Habari asubuhi, Susan.
Habari TV47.
Habari asubuhi kwako, watu wa Iten, mnaendeleaje?
Baridi tunaendelea vizuri.
Pia huku Nairobi ni baridi kabisa.
Sasa mimi nimeona hiyo program. Nimepata na labda kuwatia moyo wa mama ama wasichana ambao wako na hiyo fibroid. Maana mimi pia nilikuwa na hiyo fibroid 2018. I experienced abnormal heavy bleeding. And even at some point I would faint. I didn't know what was going on.
Okay.
And it took the effort of one clinical officer at a small hospital to help me respond to medical Eldoret.
Right.
And later on, I was operated on. At that time, goes shock if you learn that you have fibroids. But then later on, I was operated on. I was prepared. I had low blood count.
Right.
All right. Those are some of the symptoms that may come along. Later on, when I was operated on, I picked up.
How old is she?
And now I'm okay. Although I'm struggling with weight gaining. I do a lot of exercises.
Okay. You're struggling with weight issues, ama umesema?
Thereafter, before the operation, I was somehow at 72. But now you can imagine I'm around 90 after the operation. I mean, the body just responded well after the operation. I'm okay. So I'm doing a lot of exercises and also working on diet.
Fantastic. Susan, allow me to ask you, maybe around 2017, 2018, ulikuwa na miaka ngapi at that time na uko na ngapi sahi?
Oh, now I'm 49, almost 50, a month to 50. So you can now do that. And in fact, let me just, for your information, imagine I had given birth to my 6 children. So I was really wondering where these fibroids would come from, but they said it's somehow more of hormonal imbalance. I don't know how it went. I didn't use family planning as such, but okay, maybe it's just like maybe type of work. Because I'm a teacher, maybe a lot of stress, working and coming back, but I don't know. All in all, I think also the type of that thing was inside the uterus, as Dr. was trying to explain. I was saying, it is something like cortisol, something inside the uterus, it was outside.
Right.
Yeah, so the remedy actually was total, it was called hetero, something like that. It put the whole uterus.
Right.
And I think that was really a breakthrough in my life. And I want to thank the doctor and tell all women maybe who experience the same symptoms to really go to the doctor. Yeah, I think that's all I want to say.
Ya mwisho kabla labda nikuache uende Susan. After the 2017-2018 year period operation, umerudi tena right now 2024. Umefanya checkups later on.
What checkup?
Yes.
Yeah, I went for several checkups anyway, and in fact, I do the 2-year, is it the cervical checkup? Yeah, the one of cancer now, you don't just stay like that. After you do the operation, you're supposed to go for medical checkup. At least twice, after 2 years, check on other risks after an operation. There are other risks that come by.
All right.
So one has to be vigilant on that. And another thing is you keep on diet. I think that's very important.
Check on diet.
Yeah, diet.
Asante sana Susan, labda tutakuwa unaweza tutumia list ya diet yako the whole week, na pia tutumie watazamaji waone hivi ndio Susan anakula. Asante sana Susan kwa kutupigia simu from E10 back at home wherever you're watching us from, in Kenya, out of the country. Unaweza tupigia simu tuambie, what do you have any opinions? You probably have ever had uterine fibroids. How were they treated? Susan ametuambia her case, but then how was your case treated? Or rather, do you feel like you're probably suspicious, maybe flow yangu maybe imeongezeka, maybe I might have fibroids? Call us live and have those questions answered for you. An opinion on maybe what she was talking about?
It's a classical example of the patients that we get. I told you she's saying now she's about 50.
Yeah.
As I told you, women within reproductive age, if you 2017 minus the years, she falls still into that bracket. And probably she's one of the patients actually who gives us a great example to show you that it's not just lack of having children, what we call nulliparity, but also you can have children, but because of these other risk factors, we can talk of obesity, we can talk of even actually genetic makeup. If you have a genetic predisposition, your mother, your sister, or a close relative having fibroids, your chances of getting fibroids are also higher. So they're multifactorial. As I told you, there's no single most factor that you say this one, if you don't do this, you're going to get fibroids immediately. So it is a multifactorial, many factors put together to predispose you to getting fibroids. And thanks for sharing her story. Actually, it's quite encouraging that actually we can have symptoms that occur as a result of fibroids, very, very fatal symptoms, severe loss of blood, that when we do myomectomy and remove the fibroids, you can go back to your normal life.
Is there a chance of resurgence of these fibroids? Let's say even in Susan's case, later on while you do, let's say the checkups, and then the doctor tells you, well, we had treated this, go to me operate and all that. But then right now I see ni kama zimerudi tena.
So as we were going through what we call the risk factors, actually one of the risk factors of getting fibroids is the fact that you had fibroids before. So they can recur. But like now, Susan's case, it is important for people to know that actually after menopause, because estrogen is the driver of fibroids. After menopause, the fibroids tend to shrink, and even disappear. So after menopause, we don't expect a woman again to come back with a problem of fibroids. And in fact, if you don't have major symptoms, or if you are asymptomatic, even if you have a fibroid and you're approaching the age of 45, you're approaching the age of 50, sometimes you don't even touch them. We just say menopause will sort them out, because the major driver of fibroids is estrogen, which is a female reproductive hormone that is within the age of 15 to about 45 years. That's when we have increased level of estrogen in the body.
So the option of wait and watch is now after menopause.
After menopause.
But then now you'd have cases of even teenagers between, let's say, even 15 all the way, even before they actually hit 30, and well, they have fibroids. And some medics would prefer and just tell them, let's wait and watch to see how that goes. What informs the decision of wait and watch?
The wait and watch decision is informed by the type of the fibroid and the symptoms that the patient is presenting with. If a woman comes to you with heavy menses every month, you are losing blood until you have to go and get blood transfusions. Those ones are what we call symptomatic fibroid, and the treatment for that is either you go and remove the fibroid, or the fibroid will lead to demise of the patient, because we cannot allow anemia to kill the patient because the patient has a fibroid that is causing the anemia. So the decision is based on the symptoms and even the size of the fibroid. Remember, you can be asymptomatic, but these fibroids can grow huge. They can grow huge, just like the size of the baby. And you see some of the time, they can even press on important structures within the abdomen. Like, for example, the blood vessels that remove blood or transmit blood from the lower limbs towards the heart. Some of these women can just come with a clot on the one side of the lower limb. So what we call deep venous thrombosis, or DVT. So you find a woman comes to you, swollen lower limb, commonly on the left side. You do a test known as Doppler ultrasound. You find it's a clot. And then you try to extend. When you are looking for the cause of this clot, you find it's a fibroid. So some of them, they can be huge, causing pressure symptoms, predisposing to people to such issues like DVT. So for those ones, we have to go and remove them because they are already causing symptoms.
But sorry to cut you short. So in this period of wait and watch, so this lady, maybe she's in her new, it's a new marriage, and they're really expecting to have a child. But then the doctor tells her, well, there's still, it's even less than even 2 centimeters. So let's wait and watch. Does it affect any future pregnancy that this woman would want to have?
Actually, in Kenya, the commonest cause of infertility is uterine fibroids. So having uterine fibroids can predispose you to what we call subfertility levels of some sort of in your body. So if you're having inability to conceive, one of the reasons actually we find out, we send you for what we call abdominal pelvic ultrasound. And the most important risk factor we are looking out at is the presence of fibroids within your uterus. Right. So fibroids can cause infertility. But for women who come with infertility and you find the reason is fibroid, then these women fall under the category of symptomatic, because one of the symptoms is the fibroid is causing is lack of getting children. So you have to go and remove them. So removal of the fibroids can actually enhance the chances of this woman to get pregnant. But having said that, it doesn't mean that the presence of fibroids can prevent totally getting pregnant.
Right.
So we have women. I've delivered a woman with cesarean section whose fibroid was bigger than the size of the baby. So you can still get pregnant with the fibroid, but having fibroid can make you not to get pregnant.
A final one, briefly, before I get your closing remarks. Right now in the market, and when you search different digital selling applications, you get anti-fibroids herbal powder or anti-fibroids being sold over the counter. What's the danger of this? And even for someone, they probably maybe had increased flow during their periods, and they suspect that, well, I might have fibroids. Ama waliangalia checkup, and maybe akaona during the scan akaona maybe have fibroids. What's the danger of even getting an anti-fibroids over the counter? And what are some of the treatments that you feel like over the years should really come on board, even as you give us your closing remarks?
So there's what we call a Google doctor, and the habit of getting medicines from over the counter. This habit is a habit of Africans. If you go to let's say UK or United States of America, no one will give you a medicine over the counter without a prescription from the doctor. And this has to be a prescription written in a way a prescription has to be written. It can be traced back, the doctor can be traced. So this is a problem of Africa, and the problem is even bigger in our country, Kenya, because the way we have regulated our pharmacy and pharmaceutical outlets is not the best. We cannot even say to be among the best in Africa.
All right.
Okay? So this habit actually has caused a lot of problems. We have seen a lot of ectopic pregnancies. And when you go to the history, as someone tells you, I was using this herbal medication because of my fibroid. So some of these medication, they tend to take some of the conventional medications that can block the estrogen production, and then they mix with some concoctions, a powder. So whatever you're getting is what you're supposed to be getting as in a conventional way, but now we don't know the dosage, maybe lower dose or maybe higher doses. So as a parting shot, I can just say that we discourage all over-the-counter medication. We discourage the use of non-conventional medicine, the herbal medicine, in terms of treating any condition.
All right.
But I'm not disputing that they don't work. It's just that we don't have a scientific basis. We don't have that research to prove, or they have not been approved for use, and their efficiency is in doubt. So I cannot advise any woman to use over-the-counter or medicines, be it herbal medicines, that has not been prescribed by the doctor.
Right.
So let's see gynecologists, let the doctor prescribe for you. There are medicines that can be used. It is not always surgery upfront. Sometimes you can be given medicines, what we call the GnRH analogs.
Okay.
This medicine to try to stop what we call the pituitary hypothalamo-ovarian axis. That signaling of production of hormones by your ovary, there are some medication that you can use to cut that link so that your ovaries don't overproduce estrogen.
Okay.
But these are medicines that are proven, and the doctor has to give you that prescription for use.
Thank you. Thank you, Dr. Daniel Nyongesa, on this conversation. Uterine fibroids, as well as back at home, wherever you're watching us from. You probably texted us on our socials, and even to those who actually called. Maybe you're just joining us right now, and you really wanted to call in live, and probably giving you Dr.'s number so that umpigie, umuulize all this kind of questions that you really have. This conversation continues online, and just tell us there, interact with us. Have you ever had uterine fibroids? How did you actually deal with them? Or do you know someone who had them, and how did they deal with them? We wrap up this conversation right here. On the other break, Dr. I'm being told that it would be very wise for you to give us your number.
Okay.
That,
as I said, I started by saying I work with Medlife Hospital Ruiru. At Medlife Hospital Ruiru, we usually have gynecology clinics every Tuesday afternoon. The consultation is at a subsidized cost of 1,000 shillings. So if you have any problem and you're around Kiambu area, Nairobi area, you can visit Medlife Hospital for these checkups. Yeah. But for those who are interested in maybe calling, they have a question, you can reach me on my number 0707 644 915. 0707 644 915. Dr. Daniel Nyongesa.
So you're bado ndio pesa?
Ndio pesa.
So in case you also felt touched on Dr.'s nuggets, umepata namba hapo, unaweza amua pia surprise on this new month. Anyway, on the other side of this particular short break, we discuss matters first aid and just getting to know, as an adult, what do you do when you're choked? Ulikuwa kula chakula